confront a different struggle, the survival of our public healthcare system, which this budget once again fails to protect and to build. The Minister has tabled a budget of 296 billion for 2025 and 2026. While it reflects a nominal increase from last year's 277 billion, the rise is far below what is required to address the structural collapse of healthcare infrastructure, to employ the thousands of healthcare workers sitting at home unemployed, and to provide quality healthcare to the poorest South Africans. Moreover, the growth is insufficient in contrast to inflation and the population growth. 46.7 billion over 3 years is allocated to health infrastructure, but there's no clear rural allocation or transparency on its utilization. We have sent a written question to the Minister requesting a list of all health facilities that they claim to have renovated and refurbished over the past 10 years. We know, like you know, that majority of those monies they claim to have fixed our hospitals didn't even make it to the gates of our facilities. We will visit each and every one of them to expose the lies and the corruption. This budget won't result in more and sufficient employment of doctors and nurses that are sitting at home. It won't see any new and mass building of clinics and hospitals. It won't end obstetric violence. It won't absorb and train community healthcare workers at a rapid pace than what the Minister presents, and won't be filling vacancies in our hospitals. This budget won't increase mental health support for children and the youth, with only just above 40 child psychiatrists in the whole country and no plan to increase them, a country with the third highest suicide rate in the continent. This budget won't end the corruption happening in Gauteng that sees the tripling of money spent on security tenders over 2 years, but no betterment of security systems. It is good that General Mkhwanasi finally gave gravitas to our sessions, that we are being ruled by mafias, that the tender system run by the ANC and the DA is a criminal syndicate. This budget will simply go on to maintaining the status quo and finding the lifestyle of comrades and their gangster handlers, whilst our public health sector continues to crumble. This department is a daily witness and refuge for criminals. You deliver pregnancies of 10-year-old children, and you don't call the SAPS to report the rape crimes, as per the recommendations of the CGE. This department cries every day about being overburdened by illegal immigrants, yet not once have they ever called the SAPS and relevant authorities when they come over to your facilities. There's simply no commitment to build the public healthcare sector and have it provide the necessary services to our people. You will then proceed to pretend that you suffer from humanity, when in actual fact, you suffer from incompetence and lack of compassion for our people. To usher quality healthcare, prevention and education, you must redirect the NHI funding to building more clinics and hospitals in our communities, prioritizing rural areas that stand to benefit nothing from the NHI in its current form, as there's no life and net care that can hide your inefficiencies in provinces like the Eastern Cape. There's no private hospital that you can outsource healthcare from in Kokama, Taung, Msinga, Onsepkans, Nasep Balfo. Take those NHI monies that your comrades are already eyeing and employ doctors. You can't just accommodate 1,000 new doctors when over 2,000 are sitting at home unemployed, and your vacancy rate in provinces like the Free State is a staggering 22%. Cancel all tenders for cleaning and security services in public facilities and insource our people. Your comrades have eaten, it is enough. Invest in building state capacity. Increase the allocation for HIV prevention. 75.6 billion is below what is needed to expand PrEP and PEP access. Investing in PEP and PrEP is a direct investment into the future. You are alleviating the financial demands of HIV and AIDS in the future. Start today. Place focus on prevention and education. Cancer, mental health, sexually transmitted diseases, chronic illnesses can be adequately confronted through preventative measures. Prevention is the only way to alleviate the burden on our public healthcare system, and this budget is far from realizing this. We will continue to fight for economic freedom. We will continue to fight for health justice in our lifetime, and until then, this budget is rejected with contempt.